Okay. Let's treat the other side. So entrance for tier through. I used to stay closer in the beginning, make the entrance here, but I've seen that if I stay a little bit farther, it's easier to go below the orbicularis muscle.
Possibility of absorption of the blood during injection of protein hyaluronic acid with the 30 gauge needle. And there are two opinions. One opinion is that it's possible, but
Sorry, to insert?
Yeah, when we have a deadlock and we just go into the vessel.
Yes.
Yeah. And to check whether we decide or not, we absorb.
Yes.
And there are two schools. First says that it's impossible to have the absorption of the blood when we use 30 gauge needle, and we have quite cross-linked hyaluronic acid. And the second school says yes, it's possible. We have experience about it. What is your opinion?
My opinion is that it's not so easy, but I still think it might be possible. I have never experienced that, because as I said, 99% of time I use a cannula, only for the lips, but I'm not so bothered on the lips. No big vessels are there. I think that if you pull, you might be able to see blood, but I will try. But I agree that with a 30 gauge needle it can be hard. Let's say it's possible, but hard. That means if I pull and I don't see blood, is because I'm not in the vessel, or is because the blood is not coming? So anyway, I think the test doesn't give you 100% of answer. Okay. Open your eyes, look up. I'm letting the cannula find its way. I'm not pushing too much. I'm just testing where the minimal resistance layer is. And I'm sure at one point it will go. Here it is. Here it is. GP, global performance. I'm trying, what is missing here? Fat. So I'm trying to reduce fat, and I'm using the material, the product that is giving more, that is allowing me to create the softness more similar to fat. When I'm substituting a bone projection, then it's useful to use a more cross-linked hyaluronic acid. So now I am here. I start to inject. I can also move a little bit. This is a way to inject very, very familiar to plastic surgeons that are used to inject fat in this area. So this little movement reduce also the risk, especially if you are with the needle, of injecting in a vessel. I change my layer, I go more superficial. Double layer injection.
Mają Państwo jakieś pytania? Konsultacja będzie się jutro kończyć, więc ostatnia szansa, zachęcam. Okay, we have one practical question concerning women who underwent many injections and have some difficulties with taking they have an uneven shape of the open of the mouth, in the shape of inner part of the lips.
Okay, so
And how
when you mean that when you inject, you have irregularities here?
Yeah. So what to do with this?
Here. Here. You have this. Oh.
From the inner part
So
of
the question is, if with this multiple injection technique you might have irregularities, or what do you do if you have irregularities?
What do we do if we have such a patient?
Most of time, no.
Chodzi o to, że one miały wcześniej kilka wstrzyknięć i przyszły do mnie już po kilku.
Yeah, the problem is that we got such a patient after some other doctors. Yes, this is the person that was the first time in our office,
It's clear now. It's clear.
Yeah.
Okay. First, you try to sculpt the implant with your hands. No. First of all, first question: has been injected with hyaluronic acid? First question. If she's sure that is hyaluronic acid, you can try to sculpt it with your hands, but very often it doesn't work. Second step that I prefer to do, very diluted hyaluronic acid, I remove the old implant and I make it new.
At the one session, or you wait 1
No.
or 2 weeks?
One week, 10 days. Very, very diluted with the cannula. I just run into the lip contour or where the irregularities is, and I just spread a little bit of hyaluronic acid. Then you massage it. Usually it disappears immediately, but you can't inject because the hyaluronic acid is still working for 48 hours. So after 1 week it is safe. Then you can do it again. You have to warn the patient that she will look worse after that.
And do you have any products of this brand which is combined with Lanvin?
No, at the moment, but I'm sure that she's one of the researchers of the IPSA, so she can tell you maybe which will be the future plans of the.
Yes, we are working for and this is in our future plans.
So currently, would you advise to combine the product with lidocaine or you don't mix it?
Mi fai il buchino. It's never very nice to mix products, even if we do it. Let's say the truth. I do it very often with other products, but this is not something. It's not very elegant. It's not very nice. And if the patient sees that you are mixing things, she's wondering, but is the doctor injecting to me? So I think that these kind of implants are not so painful, and if you relax the patient, you talk to her, you explain what to do, I think you can proceed without. What if Sorry.
I haven't heard the question.
Part of the question. So the problem is when you inject hyaluronic acid on the periosteum. I personally don't do it. I don't like it. I think it's painful. I think it's not useful because you can't expand the periosteum. Or you can, but you have to be very aggressive. So I don't see actually the need, and This is something that we have been discussing many years ago when we, in the beginning, when we started to use the hydroxyapatite, and someone was supporting that if you inject it below the periosteum, it becomes bone, and then you can enlarge and you can sculpt the bone profile permanently. It's even surgically to work under the periosteum is not so easy. Imagine with a needle or with a cannula. So I don't personally like this point of view.
Proszę Państwa, jakieś jeszcze pytania?
So I go on sculpting my zygomatic arch.
Ja mam pytanie, ponieważ to jest wielki problem, jeżeli nie mamy tej pracy specjalisty, to prosiłam, żeby zapytać. Jeżeli wiemy już w jaki sposób radzić sobie z ustami nadmiernie przyrosłymi, to również w jakim stężeniu i w jaki sposób, bo ja mam jakiś tam swój sposób wypracowany, doktor podaje hialuronidazę, ale właśnie w okolicy wokół oka.
We have another question concerning use of hyaluronidases and its concentration you practice in the treatment of overcorrection within the orbital area.
Yes. Sorry, yeah. So just
Za chwilę skończę. Doktor Depre tam czeka.
Dziękuję.
I'm sorry.
Colleagues advise me to ask you will finish the procedure because so maybe.
So answering the question, I'm using I put 30 units of il guanto. Ed è un batufolino bagnato. Okay, let's go on. Very, as I said before, very precise implant now to sculpt.
A ja mam jeszcze jedno pytanie, czy w momencie, kiedy podajemy tą hialuronidazę pod oko, czy Pan doktor, bo rozcieńczenie to już wiele dosyć duże, ale w tej chwili, jeżeli podajemy to lepiej igłą na punkt i tam, gdzie czujemy gdzie czy lepiej taką właśnie powierzchownie podawać kaniulą pod hialuronidazę?
Ja podam to pytanie, jak Pan doktor skończył prezentację, bo jest obawa, że po prostu kamerę nam to.
Dobrze.
A Pan doktor tutaj przerwie kamerę.
It's taking too much time, this implant. This is quite, the patient is trying to go away. Sorry for my voice that is going a little bit down, but... Dai, fallo. No, non è lì. Okay. You see now, I'm injecting just in one lane. Seems to be too evident now, but what I want to create, as I said before, is just a bit of light. So now we can smoothen it a little bit. Usually it takes 40 minutes, half an hour. Very complete implant might take 1 hour, sometimes 1 hour and a half if the patient has need to do a little rest. Okay. Do you remember where we started from? You remember how she was before we started? Can you see the difference? Can you?
Yeah.
Okay. If you scratch the skin here, it's easier to find the right layer. And what if we want to inject this area? So I do an entrance here, and then you can go below the muscle, if you feel safe, and inject this triangle here. Or you can also move just below the skin, but you have to be very, very precise injecting, otherwise you can see a little bumpness, little irregularities. Okay, so you enter from here, just where we finish with the other implant, and then from here you go below the muscle and you feel this area. Very small quantity, only where you have the depression. And this allows you to have a very nice projection. And the implant goes on here and restores this line. You see now the line is a little bit, has an S proceeding, so it has to be continuous. Okay, and the same thing on the other side. And very important in this case to project the glabella. It's too depressed. And a depressed glabella a depressed glabella gives you a longer nose. Look. Okay. Okay. I think that we are perfect in time.
Okay, so when we now are in this moment that we not necessarily need the camera, we can still ask you. And there was one more question concerning whether he does this.